Hi, Mr. Grinch. I'm Alyssa. I'm going to be your nurse today. Can you tell me your full name and date of birth? Can you tell me today's date? Can you tell me where we are and why you're here today? All right, patient is alert and oriented times 4. All right, first I'm going to check your scalp. I want to just check for hair loss, symmetry. I just want to make sure everything looks normal. Everything looks good there. Now I want to test your cranial nerves. So first we're going to test your visual acuity. So I would like for you to cover one eye at a time and read the letters on the wall for me. All right, good. Now I want to check your eye movement. So I'm going to have you follow my finger. We'll look from side to side and then up and down. Good. Now I'm going to test or check your pupillary response. So I'm going to shine a light and I just want you to follow the light without moving your head from side to side and up and down. Okay, good. All right, can you take your finger and touch your nose twice on each side and then do the other side? All right, I want to check your facial sensations by just lightly touching on your face. I just want to make sure that you can feel everything. So you can feel me touching your forehead. You can feel me touching your cheeks and everything feels the same. All right. Can you move your jaw? Can you smile? Can you frown? Can you swallow? Can you move your tongue? Can you shrug your shoulders? Can you move your head from side to side and then up and down? All right, good. Can you take your hand and push your hand against mine? This tests your the resistance in your hands. Okay, good. Everything looks good there. Now I want to move down to your neck, and I'm going to check your carotid pulses one side at a time. So we'll do this side first, and I'm going to feel for 1 full minute. Then I'm going to move to the other side and feel for 1 full minute. Okay, good. Now I want to move down to your chest. So color's normal, temperature's normal. There's no wounds. I'm not seeing any wounds, scratches, bruises, anything. No cyanosis, no jaundice. So everything looks good there. Your skin is smooth, it's not dry. So first I want to check your pulses, your apical pulse and your radial pulse. So I'm just going to feel here, right here, for your apical pulse. And I'll count for 1 full minute. And then I'll check your radial pulse for 1 full minute. Everything looks good there. While I'm at your hands, I want to take a look at your nail color. Everything looks good there. Nothing abnormal to note about your nails or your hands. I want to check your capillary refill. So I'm going to press down on your fingernail. I'm checking for blood flow, the color return. It's under 3 seconds, so that's good. So next I can listen to your heart sounds. There's 4 points that I want to listen to. So I'm going to listen to the aortic valve, the pulmonic valve, the tricuspid valve, and the mitral valve. All right, everything sounds normal there. There's no abnormal rhythm, so that's good. So now I want to assess your lungs. So have you had a cough recently or currently? No, okay, good. So the patient stated they've not had a cough. If the patient said that they did have a cough, then I would ask if it was a dry cough, a productive cough, and if they had any sputum. The patient said they had no cough. So now I want to take a look at your chest expansion. So if you could take a deep breath for me. Okay, good. Everything looks good there. So now I'm going to listen to your lung sounds on all sides of your body. So we'll listen anteriorly. Everything sounds normal. So we'll listen posteriorly. And just go all the way down. And kind of laterally. Everything sounds good there. Nothing abnormal. No crackles or wheezes or anything. Patient seems to be breathing fine. So now we can move further down the body and take a look at the abdomen. So first I would inspect the abdomen. Color's normal. The abdomen is symmetrical. There's no wounds, no bruises, no cyanosis, no jaundice. Everything looks good there. So then I would listen to the bowel sounds in all 4 quadrants. So we'll go ahead and do that. I'm going to be checking for hypoactive and hyperactive vowel sounds, so I just want to make sure everything's normal. And all 4 quadrants sound good. You have normal vowel sounds. So now I'm going to percuss the abdomen. So I'm just going to touch here and lightly tap my fingers. This checks for any gas or fluid, and everything seems to be good. Now I want to palpate your abdomen, and this just checks for any tenderness or pain. So do you have any tenderness or pain when I palpate your abdomen? Okay, no, that's good. Have you had any nausea or vomiting lately? No. Okay, that's good. When was your last bowel movement? Yesterday. Okay. Was it constipation or diarrhea, or everything was normal? Okay, good. So now we can move down to your legs. So your legs are symmetrical. The color's normal. The temperature's normal. The hair is normal. No cyanosis or jaundice. Temperature was warm. An important thing is there's no edema, so that's wonderful. So now I want to check your gait. So can you walk in a straight line for me with one foot in front of the other? So we'll just walk one way, and then we'll walk back. Again, one foot in front of the other. All right, now I'd like you to take your heel to your shin and push all the way down, and then you'll do the other side, heel to shin, all the way down. All right, now I want to check the resistance in your feet. So if you'll just take your foot and press it against my hand. Okay, good, good. I think that's everything. Everything looks great. Thank you so much, Mr. Grinch.